I think we will very slowly make a start um, whilst there some more people joining us. Um, First start with saying that this webinar is recorded and will be aired later this week to help you prepare for your application. Um, Furthermore, there is also a Q&A box at the bottom of the screen where you can ask any questions that you may have. However, I would recommend that you perhaps try and wait until towards the end of the webinar because we might, whilst we go, your questions. I will first start with introducing myself. My name is Sophie. I am currently working in a different department, but I set up the training program many years ago. And so I'm here to hopefully prepare you for your application as well. And I'm joined by Wahida, who has taken over from me at the Institute of Global Health Innovation. So any questions you have after this webinar, you can email her. I'm also joined by our current trainees, Lynn, Arlette, and I think Miranda is on her way. We also have Hyun and Magda with us. They will be talking about the behavioral scientist trainee position. And I think Laura is on her way as well to join, and she will be talking about communications trainee role. Can I have the next slide, please? So tonight, I'll give you a very brief overview of our institute. I will also talk about the application process. We have two available roles for the summer cohort, and the project leads will give more information on the then our current cohort of trainees will give you some tips on how to write a successful application. And then at the end of the webinar, we'll have some time to answer any questions you have. Next slide, please. So I'll just give you a brief overview of our institute and our training program. Next slide, please. So our institute is based at Imperial College. So we're one of our global health institutes, and we have several centers who work towards providing better, safer, and more. Next slide, please. So if you wish to read more information, you can do so on our website. I will pop the link in the chat afterwards. And then if you want to read a bit more about the institute or centers or the program, you can go via that website. Next slide, please. So our training program was set up, I think it was now more than 3 years ago. So we've had 7 cohorts so far, and the training program was set up to provide paid work opportunities to those with limited or no prior work experience. We wanted to address underrepresentation of certain groups in academia, such as Black, Asian, ethnic minority backgrounds, LGBTQIA+, and those living with a physical or mental disability. So in order to do so, we've created an anonymous application and a supportive recruiting process. So as part of the role, the program will start, I think from the top of my head, it's early July. It's a 12-week scheme and you'll be working 35 hours per week. There is no flexibility on the start date. All the trainees start at the same time. I believe it is the first week of July, but we also have a timeline on our website where you can see the exact start date. You'll get 6.5 days annual leave, salary, mentorship, and references after you finish. Next slide, please. So the trainees are based in a hybrid work. Sorry, I think our trainee Miranda has joined us as well. So you'll be working hybrid, which means 3 days in the office. We're based in Paddington in St Mary's Hospital, and we work home. Those days are in agreement with your line manager. But I think the trainees will be able to talk about that more, but it's usually quite flexible when you come in the office. Next slide, please. So I'll briefly talk with you about the application process so that you know. Next slide, please. So as part of the application, you will fill in an online form, which will be anonymized. So no one from the shortlisting panel will be able to see any of your details. You don't have to upload a CV, you have to say which university you go to. All you have to do is 3 questions, and the questions are around reasoning for applying skill set. The applications close on the March, 1 minute before midnight, and we can't accept any late application. And I always say this every single webinar. I say, please don't leave it to the last minute because it's an online system. There might be issues. We've had it tried to put in last minute an application and the system didn't work. And there's nothing we can do if you submit late. So please don't leave it to the last minute. Try to do it at least a day beforehand, because if there's any issues, you can just email us and we can try and help you. With application, you can also request feedback. So it's also, you can see it as an opportunity for you to get feedback on your written application. Next, thank you. So we come to this very, very detailed overview of our eligibility criteria, and every year we get lots and lots and lots of questions. So I'd recommend, we can't in this webinar go into everyone's individual eligibility, but I would recommend you go to the website after the webinar and look into detail, or email us afterwards if you're still unsure. But to be eligible for the training program, you need to be aged 18 and above. I think for the communications trainee, we accept those university degrees. So just your A levels are sufficient. For the behavioral science trainee, they're current undergraduate trainees who are in their final year of their undergrad, current postgrad students, or those who have recently my mind's going blank, recently graduated. So do be very careful about that. So for the behavioral scientist trainee, we can only accept those who are in their final year of undergrad, doing a postgrad, or those who have recently graduated. On top of that, we're also asking that you have less than 2 months related work experience. So under related work experience, we understand anything to do with health, with science, with education, working in an office, doing administration, marketing, communications, etc. And this is both unpaid. If you've done, for example, you've worked twice for 2 weeks, that would equal less than 2 months, so that's fine. But if you have done 2 months and a half of an unpaid work in an office, you wouldn't be eligible. And the same goes with internships or training programs. We only accept those who've had less than 2 months paid or unpaid experience on an internship or a training program. However, if you have been volunteering is accepted. Also, if you have working, for example, in a shop or in a cafeteria or in a restaurant, you'd still be eligible. We also have applications from those who are studying in medicine or dentistry, nor from PhD students. Next slide, please. Thank you. So I've added a slide with almost all the questions that I've come across the last couple of years on eligibility. We can't provide visa or sponsorships, unfortunately. However, international students can apply. International students can only apply. They can apply. They can only work 20 hours during term time, but they can work more outside of term time. So this slide very carefully after the webinar. Next slide, please. So here are some application tips from me. I know ChatGPT is a very helpful tool to write and for writing applications. However, what we're looking for is applications, and we want to see someone's personality. 50 applications that are GPT, it just doesn't feel very unique. So I would say you can definitely use the tool if it makes you feel more confident in how to write, but we want to hear your voice and we don't just want to lazy copy paste. Definitely read the job description, show that you understand the role and the training program as a whole. Think very carefully about what makes you unique and what makes you stand out. There's a last section of the application, I think it's question 3, which is asking you about, is there anything else you want to add? And I would definitely encourage you to use that section. You can talk about anything that you feel like you could bring to the role that would be something that makes you stand out. And also, my last tip is on the job description at the bottom of the job, you will see essential and desirable criteria. So just try to think very carefully, how do you meet them and how could you showcase that? Next slide, please. I will hand over to Magda now and to Hyun. If you have any questions at this stage, please feel free to put them in the Q&A part and I will answer them, and also at the end of the webinar. And after Magda and Hyun have finished their section, we will hand over to Victoria, who will present for the comms trainee role.
Thank you, Sophie. Next slide, please. So we would like to start by introducing our team. The projects are part of our PhDs, myself and Hyun's, and also we have our supervisor, Gabi Juda, who is a senior lecturer in behavioral sciences, and she will be co-supervising the project. She will be here with us during the Q&A, so she will be able to answer any questions you might have. I am Magda. I'm a nurse by background. I'm currently on the second PhD, and I will be talking a bit more about my project, but I will hand over to my colleague Hyun so she can introduce herself.
Hi everyone, my name is Hyun. I'm a first year PhD student. I'm also being supervised by Dr. Juda. I am a doctor by background and my specialty is general surgery, and I'm just taking some time out of my training at the moment. Next slide, please. Magda and I just wanted to briefly talk about our project. My project is a project on a chemotherapy drug called capecitabine. Looking at what makes it easier for some patients to take it as recommended and what makes it more difficult for some patients to take it as recommended. And based on an understanding with the intervention to help improve patients' experience.
I'm looking at a cardiovascular condition called peripheral arterial disease, and you can see here a little photo. Basically, what happens is the arteries in the legs block, and this can cause a lot of problems to patients. It is very common in the UK. 1 in 5 people have this condition, and the patients have to take some medications. They need to exercise and quit smoking. And I'm looking at what helps or stops people following the treatment and how we can help them to overcome any barriers. Next slide, please.
So we wanted to just briefly touch on the aspects that you would be involved in if you wanted to come join our team. So with my project, I would with a systematic review. So that means looking at the literature on what's been written already and published, and we'll be looking at what kind of interventions there's already been done within the literature with regards to helping improve patients' adherence. And one of projects is a qualitative study, and it involves interviewing patients to find out their experiences of taking capecitabine, and I'm hoping that someone would help me analyse the interview material that I will have gained.
So I'm on my slide, please. So I have already undertaken these activities with Hyun, so my project is on the next step. We will be doing some co-design workshops with patients and some stakeholder groups with healthcare professionals to decide on intervention strategies that we will co-design. And then once the intervention is developed, the next part will be some think aloud interviews, meaning we'll explore with patients what helps them and how we should change the intervention. So you will be able to be involved in these two projects. Next slide, please.
So we now just wanted to speak about the benefits and be well suited for this project. So the benefit with us would be that you'd be part of our behavioral science team, and through these projects we're hoping that you have some transferable skills to design, research, as well as technology. A chance for you to meet a range of our partners that we work with, so that would include the NHS, industry, organizations such as patient charity organizations, and with any PhD work, any work that we do, we're hoping to publish it in academic publications, and so we're hoping to get your name on those as well.
And we are looking for someone who has an understanding, interest in health behavior and research. You don't need to have any previous experience. If you're a keen person to learn, a team player, and you want to learn more, please, we're very friendly, so we're here to support you. It would be great if you have a good oral communication skills. We want to be able to publish this work, and you will be involved in that, and conference presentations to improve your CV. And that's it from us. And we'll wait for some questions at the Q&A. Thank you.
Laura is here. Yes,
I'm
hi
here.
Laura.
Hi.
Okay, great.
Technical issues.
Always the way. Thank you, Magda and Hyun. That was really helpful. And any questions that you have for Magda and Hyun, feel free to put them in the Q&A, and I will hand over to Laura, who has made it and who will present on the communications trainee role.
Thanks, Sophie. So next slide, please. So hi, I'm Laura, and today I'll give you an overview of the communication and events trainee role. I work closely with Victoria in my role as a content, and Victoria is my line, and Peter Howitt, who's a managing director of the Center for Health Policy, the communications team at IGHI. Next slide. We are delivering the communications and engagements across a different research center at GHI to promote the research achievements, raise researchers' profiles, and support our colleagues to make an impact through communication. Next slide. So in terms of general tasks, we do a variety of things such as infographics, social media, LinkedIn, X, Instagram, but more focused on LinkedIn now, to share publications online, talk about events, programs, and also write blog posts, news pieces in relation to research papers coming up, or important events. And we put together reports in special platforms. We also look at analytics, website content, and can support colleagues with events planning and newsletters, plus media coverage whenever we get something exciting going on, and we can work we can share with journalists and promote it externally. Next slide, please. And one of the key centers within the IGHI that we're working with is the Climate Care Center. As you might be aware and can see this disturbing pictures, I would say, climate change is a growing issue affecting communities around the world. So things like floods, deforestations, events, issues leading to food insecurity have affected so many people. And in certain regions, farmers are dying by suicide as another crop fails and they can't provide for their families. And young people are feeling stressed and despair as their futures are put in peril by the adults in power who are meant to keep them safe. And there are increasing rates of depression, anxiety, and substance abuse because of that. Next slide. The Climate Care Center is the first center ever working to understand and support mental health in the current climate and ecological crisis. And we're currently in a vicious cycle. So these compounding risks are worsening mental health of people who often need to be the ones to protect their families and communities. But there is potential for virtuous cycles where climate align with those needed to create environments that support good mental health. And supporting these people is crucial, focusing on climate actions. Next slide. This is the team. We have researchers, policy experts, educators from Imperial who work together on different events and outputs, which I'll present in the next slide. You can click next one. The team has significant achievements and outputs today. They developed an agenda for global research and action. We've been supporting them throughout the process. They have connected communities of practice, media mentions. They work with different countries, including the youth and farmers and indigenous communities. And there is this website you can check out later, the Global Online Hub, with different outputs and lived experience videos, testimonials from people about the impact of climate change on mental health. Next slide. So if successful, you'll be line managed by me. Work closely with the Climate Care team to meet their comms and events needs. So these are some of the exciting projects coming up. The Climate Care's Impact Report launch. You can contribute to the write-up of the report, highlight the center's achievements, look at the social stats, the impact of previous report, and help with the formatting and design for the next report. You can also conduct desk research on the topic of heat waves and engage and interview blog. You can also contribute to the creation of engaging ways of from a project on climate change education in schools and universities, and also digital comms and event support. Next slide, please. We believe you develop lots of useful skills for your career, such as writing and communication skills in a variety of formats, data analysis, statistics skills, organizational skills when supporting events, and get a better understanding of the research and academic publication in the field of climate change and mental health, and work with lots of people. It's an enjoyable time, make connections, and supporting along the way, and learn from people's experience for your career. Next slide, which is the last one. So basically, we're looking for someone who's interested in writing, ideally, or communications, has maybe some experience, like writing a blog or university magazine, or show interest, and also show a passion for climate change or mental health or health in general, attention to detail, organization, and obviously a team player to work with our wonderful team at IGHI, which I can guarantee it's really nice. I've been here for just over 1 year, and it's been a really great experience. So thank you, and looking forward to the questions at the end.
Thank you, Laura. And questions in the Q&A. I've received a couple of questions if the webinar is recorded. Yes, it is recorded. It will be shared after the webinar, and I think it will also be placed on our website. Now I will hand over to our trainees. We've got Arlette, Miranda, and Caitlin, hopefully with us. I hope. Miranda, that's a great start.
Is Caitlin here?
Oh, hello.
There
Hi
she is.
all. Right, so I'll hand over to you.
I think we were just going to introduce us and then talk about what we've been doing on the programme. So I'm Miranda and I'm the digital health trainee, and I'll pass over to Arlette.
Hi everyone, I'm Arlette. I'm a trainee in behavioural science.
Hey everyone, Caitlin, and I'm also in the behavioural science role.
Thank you. Can we go to the next slide, please? Thank you. So for what I've been working on, so I'm within digital health. I did a postgraduate degree before this, so I did a master's, and I've been working within the patient safety team at the IGHI. So I've been working mainly on one project, but that's sort of turned into multiple things within that, which is that I've the programme is that you sort of get the opportunity to do things that maybe weren't advertised to you with the role. So firstly, I've been looking at a paper where we're identifying patient safety indicators to be used in virtual patients in a primary care setting. So I've led the thematic analysis for some of this, which was something I hadn't done before. I learned how to use NVivo and done lay summaries for this and helped with the study write-up to be published. And then that's developing the patient safety framework. I've also used Qualtrics, and I've started doing a study by starting the application to continue this work to validate these patient safety indicators. So I submitted the ethics today, I think. And then I also ran a workshop last week addressing communication issues in virtual consultation. So this was older people, and it meant so it's been really enjoyable, and that's what I've been working on. Go to the next slide, please.
So hi. So both me and Arlette are the behavioural science trainees, and we're working with Fleming Initiative throughout the past couple of months. The project was exploring what the public understand by taking exactly as on their antibiotics. And we've kind of seen this project from the beginning to the end. So we started off with doing literature reviews and then creating recruitment adverts, which you can see on the right, which was shared to social media channels. And we also did a Qualtrics survey. From there, we conducted 2 focus groups to identify like target behaviours within that, talking to the public in how they take their antibiotics and what they think can be improved. And then we did a thematic analysis as well on them insights to take to the co-design workshops, which we also did with the public, where we discussed different types of interventions that can help people take their antibiotics correctly. And and then the main goal of the project to design an intervention that will ultimately be tested in an online clinical trial at the end of May, and will be published as well. And I'm going to pass over to our talk about our other involvements within Fleming and other topics as well.
Yeah, so beyond our main project with taking as prescribed, we have been involved in a global systematic review about educational initiatives about antimicrobial resistance. So this was looking at kind of programs that teach about antimicrobial resistance in primary and secondary schools globally. And we did this through the Covenants platform. So kind of going through reviewing different literature, and beyond that, we've also attended workshops kind of external to the Fleming Initiative. So we went to on Martha's Law and got to be there with different healthcare professionals and on something very interesting and that we wouldn't have been doing within our main project. And beyond that, we've got to just meet many different people from all sorts of backgrounds, and people in healthcare, people in policy. So if you join the program, you'll be able to just get involved in so many different ways. Next slide, please. Okay, so we have a few application tips for everyone. The first one is to demonstrate passion. So I'm a second-year psychology student, so I didn't know too much about antibiotics or medication adherence, really. So kind of do your research, kind of know what you're talking about and see if it's the right fit and if it's something you think you could spend through, and try to connect it to what you are passionate about. So I, even without knowing too much about antibiotics and antimicrobial resistance, enjoy working with people and kind of go through like the person specification and see what kind of skills, what kind of traits do I have that really align with the role. So if you like working in health, if you want to work in healthcare, if you want to be kind of involved in different things, but you don't necessarily have experience in the exact topic, that's okay. Just demonstrate that you're willing to learn. And I'll hand over to Caitlin, who will do some of the other.
Yeah, so the other tip is using terminology from the job description. I remember in the behavioral science role application form, they had the thematic analysis and focus groups. And I'm a psychology graduate, so I know that we were taught a lot about the theoretical models of thematic analysis. So I made sure to include that. So we know a little bit about focus groups, so really homing in onto that. Another application tip is also to consider wider responsibilities. Arlette mentioned earlier, we were involved with the Martha's Law workshops, which is completely initiative. And we've also been involved in the systematic review as well, which is our main project. So make sure you think about other skills and include them. And then Miranda, do you want to say the last one?
Yeah, I think this one's really important when with applications is like highlighting transferable skills from previous experiences. So I know you're limited in what experience you can have for the roles at Julia Anderson training program. But I think that makes it almost more important because it shows how you can be adaptable. So if you look at skills from maybe a part-time job that you've had, and what skills that's given you and why that would be important working at IGHR, highlight why you can use that in the role that you're applying for. Mentioned if you'd written a blog post or something at university and you're applying for the communication role, that's exactly what they're looking for in your application, and use that last section to really express yourself with that. So yeah, that would be my biggest tip for applying.
Thank you. Done? Yes. Well, there's another great example showcase what trainees get involved in to come and present at a webinar. So thank you very much for everyone who presented. We're also joined by Gab, who's going to line manage the behavioral science trainee, so she'll be able to answer some questions. I think we've got about there were some questions that we can answer live. The first one was, are we able to reapply if rejected? And the answer is yes. You're more than welcome to reapply. Actually, we have had a trainee in the past who applied and even to the interview round, didn't make it through the interviews, and then he applied the next cohort, and then he did get the job in the end. And he said that he had picked up some of the feedback to improve himself. So yes, you're more definitely welcome to reapply. I will start with one question about for us, because I had mentioned be unique in your application responses. Would you be able to provide us with an example of a previous applicant who you feel demonstrated a unique quality or skill that to their application and that stuck out to you? I think I might send that one to the trainees actually. Do you remember what you wrote on your application? There was anything that you feel that was unique? I'm going to read so many applications in the past. They've all blended kind of into one. I think I remember one which was very unique. It was for a trainee who helped me out on the train, and they had been farm. So they helped boost sales of their apple jam on social media to show that they love working on social media, which stuck with me, and I thought that was great. But I don't know, Caitlin or Miranda, Arlette, if your application, if there was anything particular used in a way to showcase yourself.
I did speak a lot about my like working in customer service quite a lot. I know that in my application I mentioned I used to work in Adventure, which is like a kids leisure at park. So I wrote a lot about that, but I can't think of anything unique. But other
I
than
think
saying about my
also a really good example. I think that was a great example to showcase how you picked up some skills and could transfer them into
a lot of transferable skills in customer service, I remember mentioning lots.
Yeah, I remember that from your interview. Gabby? Sorry.
Sorry, Caitlin, do you want to finish? I'll go after you.
I think it was Arlette who was coming in. Arlette, do you want to come in?
I was just if you do have a personal kind of connection to the topic, or if you do have a specific reason you want to be in the role, definitely mention that, because it makes it a lot more personal as opposed to, oh, I had this experience, and this experience. But if you have like a kind of more personal reason why you, I don't know, want to work in healthcare, for instance, or work in public health, at least for the behavioral science perspective, that's kind of what I was writing about. I definitely tried to incorporate that a bit in my application and in my interview, so you can keep that in mind. Sorry, Gabby, go ahead.
So, similar, that if there's some background that's quite unusual or that gives you a particular connection to the topic, then please do mention that, because that's always really good to hear. And I know not everybody has this kind of unique thing like working on a farm or having a connection, but just to say, we've also had students who have talked about their dissertation and given some details of work that they've done and that they've clearly been very passionate about and worked on independently. So that's also something you can bring in, and that we would kind of unique, personal, you may not think belong on a CV. You feel that there's a connection to the role, but don't worry if you don't have that, because of course lots of people don't.
Thank you, Gabby. We've got some questions for your role. The first one was, you mentioned publication as a potential outcome. Would the trainee also have an opportunity in presenting the research, for example, at a scientific conference like?
Yeah, that's a great question. So I think the issue with conferences is that there may not be specific funding for them. So I don't know in the past who's actually presented themselves, the work themselves at a conference, but we have had people who have been an author on a conference abstract. So it lead author. So in the case of our project, Hyun and Magda, it's their PhD. This project would be supporting. So it could be that they would present at a conference using funding that they've got for that, but your name on the output, you would be an author on the conference presentation. That's something that could go on your PhD. If there are any sort of engagement opportunities, then we will make sure to send, but it just depends on what is available funds for.
Yeah, that's great. And I think that other opportunity able to present your work, for example, in internal group calls or staff calls or networks. One of the trainees once presented their work to the funder of the project. So there are always opportunities. It just depends on what comes around. There's a few questions around the program. change each cycle. So I'm assuming you mean, do the jobs change? So yes, we always have other on each cohort. The summer one is the communications one and the behavior science one, of course. But we've had lots and lots of different trainee roles, and it's a year. So this is for a summer cohort, which starts in July. Our current trainees started in January cycle and a July cycle. We don't know yet what the roles will be for the January 26 cohort, but it will get announced online once that's available. But for now, we focus on the summer one. I think I had another question for you, Gabby. They're asking, when we demonstrate and explain having behavioral science / behavior change, does this need to be directly relevant / related to medical treatment adherence?
No, it doesn't have to be relevant to medical treatment adherence. So if you've got experience or training or you've learned about behavior change related to something else, then that's still very transferable skills. So please do mention that in your application.
Great, thank you. Another question was about the scope on in the team or work on other projects after trainee roles, for example, as a research assistant. That is all dependent on. It's it's always brilliant when a trainee can stay on, but of course it's very dependent on opportunities, if etc. So we can't promise anything beforehand. Magda, did you want to come in?
Yeah, sorry to interrupt for that. I just an example that it depends always on the family if someone can stay or opportunities are, but we did have a last January, January 2024, and she was able to remain part of the team because there was a job opportunity. But of course, we will be looking out for you and supporting you and letting you know of what else is available whilst you're in place.
Yeah, and I think Gabby also has a trainee from so secured a job as a research assistant. That role helped them, the job with Gabby program helped them to develop their skills, publication, I think, which helped them also job into research assistant role as well. I know that Magda and the team really helped a lot with the previous trainee who got a job at Imperial later on. So I hope that answers the question. Gabby, did you want to add in?
Yes, just separately, you'll also be who can also support you with things. So, for example, looking over applications or CVs. So even if you're not able to stay on, hopefully give you some feedback, which will help you in future applications as well.
Yeah, thank you, Gabby. Eligibility. So I would suggest that you carefully read through the eligibility criteria. It's very detailed. I've put the link. Just go and read through it. It's very, very detailed on eligibility criteria. And if you still are not sure, then do have an email. There's also a question how many people usually apply per role. I think I also in every cohort. It's a hard question. I don't really like answering it, but like sometimes it can be if you put a number on application cohort. But I would just say I very much encourage you to apply. Don't get and don't pin yourself down. Oh, there might be 100 other applicants, or there might be 2 other applicants. Just put your best foot forward. Is what I would say. I have a question for the previous trainees. What are they actually are current trainees? What do you think you got out most from this program, and how has it helped you in your future prospects?
Shall I go first, guys? What have I got out of this project most? I mean, other than the outputs, like being published, hopefully when that all goes through, because it's a lengthy process. You gain so many networking skills. I hadn't spoken to researchers in different fields before. Brilliant skill I think I've learned in the last, I think, 10 weeks now that I've been here. Was it how has this helped me? Helped me. I think it's given me what I want to do and what I don't want to do, like what research and maybe what I don't. So there's like positives and negatives to the whole thing. But yeah, it's been a really sort of invaluable experience that I've really enjoyed. So I'd really encourage everyone to.
I'm happy to go. So similar to what Miranda was saying, yeah, the program gives more clarity on what you enjoy and what maybe you don't enjoy so much. In the behavioral science role, I guess, kind of clarified like working in research a bit about that, and also mentorship. So you get to talk to people who've had such unique backgrounds and maybe that they never thought they would work in, and just I've gotten a lot of good advice about applying for master's programs and stuff like that. I really do get a lot. I'm not sure if that happened, but yeah.
Yeah, just echoing with what you both say, and as well, it really does open your eyes, apply your maybe learned experience from uni into a practical setting, definitely for me, and also opens your eyes to a lot of different roles that you may have considered before that now you're thinking about as well for employment. And yeah, it's been great.
Great. I think our Let's On ties into another question which answer, because someone asked if the training specifically aimed at to do a PhD or pursue verbal in a career path, like policy, NGO work, etc. So definitely does preferable skills, because the unique thing about the Institute of Global Health Innovation is that you have a lot of people backgrounds from different career fields coming together. So you'll be working with policers, with doctors, psychologists, nurses, yeah, lots and lots of different people from education. So there's people from different walks in life or different career paths that all come together. And like Gabby mentioned, you also get a mentor, and there's lots of opportunity and scope to widen your network, but also talk about different, and to also progress your skills as well. Then there's one question for Laura. So for the patient's assistant role, do you have any tips for best to link it to a passion for healthcare more broadly?
Yeah, I think it's very personal, right? Because it's what motivates you in general. But if you can show like general passion for global health, and the environment, climate change, it can be, the passion for writing as which is like health and climate change related, but it's also like the skills you can say, like, you want to explore or like develop the skills in science communication. Maybe you like reading, like maybe you want to explore this side and promote researchers' work. So you're interested in media or PR stuff. So it really depends what you can. But if you can show like this passion, like, it's important writing, then obviously, it will be the same in the interview.
Thanks, Laura. I have a question, because you're still in uni studying. So where do you find the time to work plus do your assignments?
Yeah, so great question. I work part-time, so I'm working 20 hours a week now. I'm not gonna lie, it's hard. It's because I also do a lot of, if you do a lot of like extracurriculars on the side, like societies and sports and stuff like that, it is challenging. Um, I just, I think ensuring that you kind of are really good with planning, and I'm assuming if you're in this role, you've had a lot of experience with time management because beyond you have already had to do that. Definitely line manager about managing your work. You'll have check-ins every week with them, probably because we have check-ins every week. And just make sure that you communicate well with everyone around you. And yeah, I guess it's more about if you're in uni, I would recommend obviously you work part-time. So that answers the question. Just time management and communication with your manager, or if you're working with another trainee, like me together, we just kind of communicate.
Yeah, yeah. And I think that's something that I really admire. Whenever someone comes in and fine, there's that working, I always think it's something very admirable. Someone asked about the time, so I've popped in the chat the link to our website with the timeline. So the applications close the March. There will be shortlisting until around the 16th, and there is also in between that. So you'll hear back from us the end of April. Now, that's an indication, but if we, for example, receive a lot of applications, there might also be a little bit of delays. However, if you haven't heard from us, means there is no decision yet. You will hear regardless if you have been successful or if you have been unsuccessful. If you have been unsuccessful at that stage, you can ask for feedback. If you have been successful, you will be invited for interview, and the interviews are mid-May, I believe. And there will also be a webinar to you for your interview, which will be held early May, but you will receive an invitation for that as well. But the answer is, as long as you haven't heard back on your application, it means no decision has been made. I will just take the last question before we end here. The question is it the case that the later you apply, the less likely you are to be successful? No. So all applications after the deadline only, so it doesn't matter when you apply. However, I will repeat again, please don't leave it to the last minute, because if there's technical issues at the last minute, we can't accept late applications. So I would definitely recommend put your application in by the 29th of March. 30th of March, because any late applications can't be reviewed. But yeah, we won't review applications until after the deadline. So we're going to close here. I wanted to thank everyone, especially the trainees, the panel members, Wahida, for joining as well. The recording right after this webinar, and questions, please email Wahida. I have popped her email address. And good luck with your application. And thank you so much for joining, everyone. Bye.